Drug abuse is both a global health and social problem with distinct conditions and problems that vary from place to place. Around 275 million people used drugs worldwide in the last year, while over 36 million people suffered from drug use disorder, according to the World Drug Report released by the United Nations Office on Drugs and Crime (UNODC) in 2021. A Nigerian National Drug Use Survey revealed in the previous year that there were around 14.3 million drug users, of which close to 3 million suffered from a drug use disorder. Drug abusers have also been linked to why the nation records crime daily. These and many more were reasons why the MLC TV met with a pharmacist, Grace Oluwatobi, in the quest to know how the situation can be managed, if not ameliorated. Our reporter has more. Substance abuse is a serious issue, a global and international issue, particularly in developing countries like Nigeria. Pharmacist Grace Oloruntobi Folorunsho explained that drug abuse is an aggravating factor for the economic crisis, adding that youth are supposed to be the major agent of change and development, some of whom have been destroyed by drug abuse and rendering them unproductive in the society.
The burden of drug abuse in Nigeria has become a major concern, health concerns, because we are having a lot of people that are having drug abuse disorder. So I think that the state is actually not very good. It's on the increase.
She emphasized that 15% of the adult population in Nigeria between the ages of 25 to 39 are victims of drug abuse.
The drug don't longer work the way it should work. It becomes insensitive, and then they now keep on increasing the dose since they are not getting their result. And that increase of dose eventually make them to become dependent, to be psychologically dependent on those drugs, and also it eventually leads to the dependence eventually leads to addiction, and that's how it becomes a problem. So the advice to the government would be that firstly, the government can help to curb these things by increasing opportunities to the youths, because a lot of people that have gone into drug abuse do not go into it because voluntarily. They are just trying to swallow up the pain and frustration of not having something tangible doing. So when opportunities are available for the youth, which are predominantly implicated in this drug abuse, it will help to reduce the menace. And also drugs, governments can also allocate funds to drug-related agencies. So we have NGOs, we have outreaches that can be done to be able to educate people on that. So the government can help in that way. And also parents can go a long way in helping to reduce drug abuse.
Speaking further, pharmacist Folorunsho explained the difference between drug abuse and the misuse of drugs.
Drug misuse has to do with prescription drugs. When drugs are being prescribed, drugs that are being prescribed are not used the way they ought to be used. It can be that my friend has this particular concern and the doctor prescribed this, so yeah, use this. Or there are some even cases where you dispense drugs, as we as pharmacists dispense drugs to patients, and I'm like one daily, this is not going to work, and they get to use 2 daily. That's misuse of drugs. Or they'll decide to use it whenever they feel like there are some drugs that are drowsy. We specifically tell them that these drugs, you are going to use them when you're about to sleep. If you are going to be operating heavy machines, you don't use them at such times. So when you don't use them when you are supposed to use them, or not the way it is prescribed, that's what misuse of drug is.
The pharmacist said the abuse, on the other hand, is the intentional misuse of drugs to achieve an outcome such as getting high or escaping reality, adding that both are dangerous and deadly to individuals. Jennifer Odimayo reporting for MLC TV.